More than 4.5 million workers quit their jobs just in November, and the resignation rate has increased in businesses, large and small. If you recently left your employer or are planning to, Sharon Epperson is here with what you need to do about health insurance first. Sharon, good morning.
Good morning, Becky. You know, if you quit your job, you generally have three options to continue your health care coverage. You could keep your job-based insurance through COBRA, which is typically available by federal law for up to 18 months after you leave your employer. You could buy an Affordable Care Act plan through a public exchange on the health insurance marketplace at healthcare.gov, or maybe switch to your spouse or partner's plan if that's available.
It's a three-pronged decision: spouse, ACA, or COBRA. And it's important to not only weigh the cost of the premiums, but the cost of the deductibles and co-pays and your underlying health condition.
With COBRA, you can usually keep the same providers, but you'll have to pay more, maybe the full cost of coverage. So Aetna CVS Health Chief Medical Officer Dr. Q. Rees says to consider this when evaluating marketplace plans.
You want access to the 3Ds, the doctors, the drugs, and the diagnostics. Leverage these exchanges to look at those high-quality plans, alignment with your providers in an area that is affordable for you and your family.
If you're on the fence about what coverage to choose, well, time is running out. Tomorrow is the last day to enroll in or change an ACA plan for 2022, Becky.
Wow, it's a good heads up if tomorrow's the deadline. You know, Sharon, that COBRA insurance can be really expensive. If you do have coverage through COBRA because you want to keep the same providers, is there any way to cut down on the cost? Any way you can kind of cut corners?
Well, a couple things to keep in mind. If your COBRA is running out or your COBRA costs change due to certain circumstances, you may qualify for a special enrollment period to make a switch to a health care marketplace plan. Now, that's going to likely be a lot less expensive. A new government report shows that the majority of consumers that are enrolled in ACA coverage on healthcare.gov have deductibles under $1,000. So you want to check out your options for marketplace plans, and you may find a lower cost ACA plan that's going to let you keep your medical providers, the ones that you want and the ones that you've been with. And another thing, Becky, I want to tell you, there's a tip here that I got from one financial advisor that if you're getting your coverage through COBRA, you can use money from your health savings account to pay the premiums. Your HSA is not tied to employment.